Coach Tess from HealthEversity, and today we are going to be focusing on modifiers. This series is going to be focusing on CPT modifiers for the CPC exam. So let's jump right into it. Hello everyone, and welcome back to our series of modifiers. And today we are going to focus on modifier 51. So here's my purple highlighter that I use to make my notes, and you should have your highlighters when you're making your notes or reading as well. Okay, so let's jump right into it. So modifier 51 covers multiple procedures. Look at my purple guy here, and he has multiple injuries right here, right? So it's a different procedure and separate from. So it's multiple procedures in the same area. So look at his leg right here. So he has multiple procedures on this one leg right here. All right, so let's jump right into the key points. Okay, so look at this. So the use of modifier 51 when multiple procedures are performed on the same day in the same operative session. Do not append modifier 51 to add-on codes, and those add-on codes you actually can see at the bottom of your CPT manual, as well as there's a plus sign beside it in your different code sets. Okay, do not append modifier 51 to procedures that are exempt from modifier 51. When twins, okay, so when delivery of twins is reports, one method of reporting is used to the appropriate code with modifier 51 appended to the second procedure. So this is twin 1, and then for the second twin you'd use modifier 51. So that's pretty easy. Just have to know it, just read it, keep reading. All right, let's look at this example. Look at my guy again. Okay, so now let's look at this question. John Jones has a puncture aspiration of an abscess on his left shoulder. During the same session, the cutting of three benign hypokaryotic lesions also occurred. So see, the first procedure, they did it with the puncture aspiration on his left shoulder, and during that same time they handled 3 benign lesions. So that's where it is multiple procedures in the same area. So you have the puncture, right, the puncture aspiration, and then you have the cutting. So you have 2 procedures, right? So you use modifier 51, and there you have it with modifier 51. Stay tuned as we continue in our modifier series. Talk to you soon. To our series of CPT modifiers for the CPC exam. And today we are going to focus on modifier 52. See, you need your highlighters, and you know, this is my famous purple pen. Oh, it's not a pen, it's a highlighter. Okay, so let's focus on modifier 52. Okay, so modifier 52 is reduced services. So it's partially, these are the keywords, be reduced, part of a procedure, or not completed. Okay, so it's partially, to be reduced, part of a procedure, not completed. So those are some of the keywords so you can identify that modifier in your question or in the chart. Let's move on to our key points. And the key point is do not use modifier 52 if the procedure is discounted after the administration of anesthesia. Use modifier 53 instead. All right, so let's take a look at this. Kevin is 10 years old and is presenting for a physical for soccer camp. His physician reviews the camp forms and performs the required physical, but no comprehensive history is obtained. The examination is detailed but not comprehensive. So what happens? This is what he presented for this physical right here. Okay? And then the physician reviews the camp forms, right? That is required. Okay? So look at this now. See? It says reduce services, partially to be reduced, part of a procedure not completed. So let's look back at this again. It says the physician reviews the camp forms, performs the required physical, but no comprehensive history was obtained. Okay? So now the examination is detailed but not comprehensive. So he basically was supposed to do a whole thing, but he only did a part of it and he reduced it, and he has to explain why he did what he did and the reason for doing it. Okay? So we are going to use this code 99393 modifier 52. Well, we've come to the end of modifier 52, and guess what? Stay tuned as we continue in our series.